Good afternoon, everyone. It is noon, so we are going to go ahead and get started as people continue hopping on. My name is Allie Wells. I'm the Communications Director at the Foundation for a Healthy Kentucky. Thank you all for joining us for Health for a Change, taking action to reduce cancer disparities. We've got a really great webinar in store for you all today. Before we get started, just a little bit of housekeeping. If you have any questions during the presentations, you can put those in the chat and we'll address all answers at the end. There are no pre-approved CE credits attached to this webinar. However, I can provide a certificate of attendance for joining the live webinar today. If you'd like one of those, just put your name in the chat. I'll also put my email in there and you can contact me that way to ask for one. Now, just to tell you a little bit about the Foundation for a Healthy Kentucky, we are a nonprofit, nonpartisan organization, and our mission is to address the unmet health needs of Kentuckians. We want to create an environment where everybody has what they need to live a healthy life. So we want to make the healthy choice the easy choice. And to do that, we try to reduce disparities and improve policies and programs on the state and local levels around our two focus areas, and that is access to healthcare and children's health. Now I'm going to turn things over to our speakers from the Markey Cancer Center's Appalachian Career Training in Oncology, or ACTION, program to introduce themselves and get us started.
Thank you very much, Allie. Again, my name is Nathan Vanderford. I'm a faculty member at the University of Kentucky College of Medicine, and I'm the director of the ACTION program, the Appalachian Career Training in Oncology program. And we're very happy and excited to be here today to talk about the cancer disparities, particularly in Eastern Kentucky, and how we're using ACTION as a long-term strategy for addressing those disparities. So, and I'm here today with...
I'm Holly Burke. Thank you all for joining us. I'm the program coordinator for the ACTION program. And today we also have 3 students who are going to be with us. We have Kennedy Lamb, Kaylee Cottle, and Erica Criswell, and you will get to hear from them towards the end of our presentation.
Thank you, Holly. So today what we want you to walk away from this webinar understanding is the following. So we hope that you'll have a better understanding of Kentucky's significant cancer problem. We'll talk more about that. Understand, although many of you are probably aware of the key health behaviors and social determinants of health that drive Kentucky's cancer disparities. And then we hope that you have a good understanding of the ACTION program and how we're using it as an educational intervention to address the education and cancer disparities that exist in Appalachian Kentucky. And particularly, we hope that you have a good feeling for how we do that through the experiences of students who you'll hear from today. So, as you all, many of you probably know, cancer is a major public health problem in the U.S. and globally. In the U.S., it is responsible for about 2 million new cases each year. And the figure here, you can see on the top part of the panel, how that breaks down in terms of cancer sites. And you can see that prostate, lung, colon, and breast cancers make up the majority of new cancer cases in the U.S. It's the second leading cause of death in the U.S., over 600,000 deaths each year. And in the bottom part of this panel, you can see how those break down by site, with lung, prostate, colon, pancreas, and breast cancers causing the majority of cancer mortalities. So although we're making a lot of headway in terms of cancer treatments and prevention, it's going to continue being a major public health problem, and it's expected that number of new cancer cases is going to continue to increase by as much as over 70% over the next couple decades. And the overwhelming reason why that is because we have an aging demographic, and the number one risk factor for getting cancer is age. So as the population ages, we're going to continue seeing a number of new cancer cases. There's a lot of examples of cancer disparities. One example is the way men and women experience cancer. About a third of women are expected to develop cancer in their lifetime, and around 50% of men are expected to develop cancer. There's lots of other cancer disparity examples, and we're going to talk today specifically about Kentucky's cancer disparities. So Kentucky has a massive cancer problem. We rank first in the nation in overall cancer incidence rates, second in overall cancer mortality rates, over 30,000 new cases each year, 10,000 deaths. And so that's a big problem, and that's bad. What's worse is that the cancer problem is significantly greater in Eastern Kentucky. So there are 54 counties in Eastern Kentucky that are in the Appalachian region, and cancer rates there are significantly higher. For example, lung cancer incidence rates are over 100% higher in Eastern Kentucky versus the national average. Appalachian Kentucky residents are 8% more likely to die from a preventable or screenable cancer than their non-Appalachian counterparts. There's a lot of other statistics, but just suffice it to say that the cancer problem is very bad in Eastern Kentucky. So this slide is a little busy, but it shows you in the top portion of the slide here are cancer incidence in Kentucky, bottom cancer mortality. You see the top 5 cancers that cause the most number of new cases in Kentucky, with breast cancer being number 1. Then you see the rate of that cancer in the state. And then you see how that rate compares to the national average. And then there's information on whether or not there are disparities that exist around that cancer in different aspects of Kentucky, rural Kentucky, Appalachian Kentucky, and Black populations in particular. So we're number 1 in lung cancer, for example, 71% higher rates than the national average. And you can see that there are disparities that exist in rural and Appalachian Kentucky. Now, I won't belabor going through all these, but moving on to mortality, you can see that lung, breast, prostate, colorectal cancer, and pancreatic cancers cause the most mortality in Kentucky. And if you recall from the national data that I presented earlier, these types of cancers line up really well with what causes the number of new cases and mortalities in the whole country. But for mortality, we're number 1 in lung cancer, 80% higher than the national average. And there's disparities that exist in rural Kentucky and Appalachian Kentucky. So what drives this massive cancer problem? It's a number of risk factors, social determinants of health and health behaviors. Few examples to go through. So we don't do so great in terms of smoking rates. We're 4th worst in the US, 40% higher rates than the national average. There's disparities that exist in many different populations, rural Kentucky, Appalachian Kentucky, and Black populations. We're 2nd worst in obesity, with rates that are 23% higher than the national average. And we have really high infection rates of HCV. We're 6th worst, 100% higher, over 100% higher than the national average. We do okay in terms of screening. We're about on par with national averages, but we do really well in lung cancer screening, and that's been very intentional. There's been a lot of activities that have been focused on enhancing lung cancer screening, and that's driven by our high lung cancer burden, in the hopes that some of this screening can really over time help us reduce that burden. There's a number of other risk factors, just go over a couple other examples. So education influences cancer rates. So what you see on this map, the darker shaded counties here, there's an overlap with lower education attainment, lower basic literacy, and higher rates of lung cancer incidence and mortality. And you can see that overlap is greatest in Eastern Kentucky. So there are a number of things that play a role here. I'll get into those in just a second. But I also wanted to say that poverty is also a major problem. So in Kentucky, 17% of the population lives in poverty. 45 counties have persistent poverty. You can see that the majority of those counties exist in Eastern Kentucky. And persistent poverty is defined as rates of poverty in a county at the level of at least 20% or greater. And those rates had to have persisted for at least 30 years. So that's a significant amount of poverty that's existed over decades. So that's a major problem. So how does education and literacy and poverty relate to cancer? In general, people with these these situations have, more higher rates of poor health behaviors, more issues around things like healthcare access. Maybe they have lower insurance levels, and so it's harder for them to gain access to healthcare. The culture of Appalachia also is a factor, I think, in terms of the high rates of cancer. So Appalachia rural areas have rich traditions. This can include tobacco use, generational tobacco use, and maybe this is not intentional, but a lot of times you'll have, family members that smoke, and then their kids will smoke, and it just continues down through generations. There's strong family and faith connections in rural areas, including Appalachia, and some of that can lead to fatalistic views around health issues. Appalachians are fiercely independent and self-sufficient, and that can relate to a result in poor health care seeking behaviors. There's a lot of value around hard manual labor, which can lead to exposures that are harmful, including sun and toxins. Education is not greatly valued in some of these areas, which can, again, correlate with poor health behaviors and risky behaviors. And there's a celebration of some of these industries that cause cancer, that have put us at greater risk for developing cancer. There are counties in Kentucky that have tobacco festivals in the fall to celebrate the tobacco industry, and so that perpetuates some of these unhealthy behaviors. So just as sort of a summary, this is a map of the entire Appalachian region. So stretches a 13-state area of 420 counties. Eastern Kentucky takes up the majority of central Appalachia. I told you there's high cancer rates driven by high smoking, obesity, chronic infection levels, poverty. Poverty and economic distress is what this map particularly speaks to, with the red counties being counties that have distressed economic levels. And then there's low healthcare access, low healthcare engagement, low education levels. So ultimately, it's just sort of a perfect storm for a collection of risk behaviors, unhealthy, health behaviors, social determinants of health that drive the high rates of cancer in Kentucky. So because of this, and because of my own personal experiences with cancer that has occurred in my family, I was very motivated to develop the Appalachian Career Training and Oncology Program, or ACTION program for short, in 2016. In this program, we engage high school students and undergraduate students from any of the 54 Appalachian counties in cancer research, cancer education, clinical shadowing activities, and outreach, all around the goal of motivating and preparing them to pursue cancer-related careers. So we've been doing this since 2016. We've had over 150 students that we've engaged in this program from 40 of the 54 Appalachian counties. We've had about 42 that have gone on to professional or graduate school, with the majority of those going to medical school. And many of these students stay here at UK because of their passion for Eastern Kentucky and their home communities. We've had one that got a PhD in cancer biology. 45 of our 48 eligible high school students that have graduated high school have matriculated to college. And our these educational attainment rates far exceed the educational attainment rates expected for Eastern Kentuckians. So they've had all these phenomenal educational attainments, but they do a lot of other things too. We've had a homecoming king. We have a current student body president here at UK. And we've even had a wedding between two ACTION alumni this past June. So lots of fun things. Our undergraduates have co-authored 20 peer-reviewed manuscripts. We've published a bunch of papers about ACTION, and we've published 3 books that Holly's going to tell you more about. We've done a photo voice project and a short video project also, and Holly's going to tell you more about the books and the photo voice project. Holly?
Yeah, thank you. All right, so we wanted to dive deeper into the two projects that we are really proud of that we've worked on with our students. So the first one are these essays that we've had students publish, and we know how important cancer statistics are, but the stories we really wanted to share with the communities. So students wrote culturally focused essays talking about the effects of cancer in their hometowns in Appalachian Kentucky. And this helped show the understandings of how cancer impacts the youth in those regions. So we gave them this prompt that was for them to write an essay about what they notice in their hometowns. And through this exercise, they were working on their storytelling. They talked about experiences with cancer and why they think the rates are so high. And then they also gave solutions on what they think can be done to lower those rates. And then we had very intense editing process where students did peer review and editing, and then also program director and coordinator editing. Something that a lot of our students we're not used to, especially in our high school program, because a lot of times when they turn in a paper, they never think about it again, and they ended up having to look at these essays multiple times and did lots of revisions. So through this, we also use content analysis to identify common themes in the essays, to talk about the types of cancers that students talked about, the feelings toward the causes of cancer, and then those proposed solutions. So here we've got this big slide with all of the different themes that drive high cancer rates. So these were things that our students were talking about and acknowledging. So the first one was about the geography of Kentucky, talking about the tobacco industries, the coal mines, and then also that low access to healthcare, the long distance, and then the few opportunities they felt their communities had for screenings. They discussed poverty, um, and a huge portion of them talked about food deserts and swamps and this idea of high consumption of fast food, cheap processed foods that can increase obesity rates, and their lack of ability to get fresh foods. The environment, so there was a lot of talk of water contamination from the coal mines, and then also improper waste disposal, such as burning items. That is pretty common in Eastern Kentucky. Dr. Vanderford talked about the low education rates, and because of these low education rates, students talked about that they are at more of a high risk to use tobacco, be out in the sun longer, poor diet, alcoholism, substance abuse, and then their awareness of cancer in Kentucky is pretty low, not understanding the symptoms or knowing when they should get screened. And then this idea of the culture of tobacco, this symbol of heritage, it's culturally accepted, and many people start smoking and using nicotine products at a very young age. And then the last box talks about the lack of prevention, but also medical mistrust. A lot of students referred to family members refusing to go to the doctor and not trusting um, kind of the white coat syndrome. And then also saying things like, this won't happen to me. I'm not having any symptoms. I don't need to get screened. And then also this idea of if I'm going to get cancer, then it is what it is, and there's nothing I can do about it. So then students not only talked about all of these issues, but they talked about their solutions. And as you can see from the slide, they had lots of different ideas, but the one that we saw the most was this idea of improving education and awareness. So starting young, starting in the schools, and having education around cancer awareness. They talked about increasing screening opportunities, tobacco cessation programs, increasing quality access to healthcare, decreasing poverty, improving diet, changing the tobacco and coal mining industries, increasing exercise, and increasing research. But ultimately, the big one was the improving education. So our conclusions through this was that storytelling helps our students understand things better and helps tell the whole story and not just that data piece. It helped our students gain a better understanding of cancer in their families and their communities, and it also helped them think about what they could be doing in their hometowns. So there was multiple things that happened for our students in an educational arena. They improved their writing skills. They had very important conversations with their families surrounding cancer that they weren't having before. And then they were able to reach their family, friends, and community members with important cancer information. So then not only have we done the first two books with the essays, is we have a third book that was published last December. And this one was different. This one we had students write realistic fiction stories about cancer in Kentucky. So this one's called Cancer in Appalachia, a collection of youth-told stories. So they got to develop their own characters that represented people they knew or had heard about in their hometowns. And so this was a new method, a new way to get people involved, the community involved, and get people who mainly prefer fiction stories to read about cancer in Kentucky. And we currently are working on our second volume. It is in the editing stage right now. So then our second project is the Photo Voice project, which Photo Voice is a community-based participatory method where we ask a question or have students respond to a statement with photos that they can share with the community. So our question to them, or our statement, was go out and take photos of things that remind you of cancer. And we didn't give them a lot of directions. We didn't give them professional cameras. They used their cell phones or their own cameras, and they took photos of things that reminded them of what cancer looked like in Appalachia areas. So these photos have been shared through social media posts, and then we also have had public exhibits. And then we also use content analysis to identify the themes in those photos. So on the right, you can start kind of seeing some of the photos that we have. And we have things from the wonderful plate of fried food, where the student talked about how that was a common staple in their hometown, common staple in their family, but also this unhealthy eating can increase the risk of cancer. We've got a tobacco barn, and then students also took pictures of things that reminded them of cancer, such as events like a walk or a run for breast cancer awareness. So really looking at the community support. So I'll give a couple of seconds for you all to look at all of these photos from our students, and you can see all the different routes they took, things that reminded them of cancer. So then these also were put into kind of categories, themes, and these were things that we saw that our students took from these photos. So we had lots of photos of risk factors and exposures, healthcare buildings and access to healthcare, their personal experience. So a lot of students had photographs of things that reminded them of family members, marketing, awareness and support, and then also metaphorical representations. So not only did students take pictures of literal items that they saw, but they also took metaphorical photos. So an example of that, we had a photo of a student who took a picture of a butterfly. And in their caption, they talked about butterflies change and go through a process, and talked about how Kentucky needed new policies and needed to change for the betterment of a healthy Kentucky. So students really had free range on how they interpreted this project. So again, we got a few more photos that you all can look at. And then ultimately the results showed us the prevalence of tobacco in the Appalachian regions, the presence of harmful chemicals relating to the coal industry, unhealthy food options and eating habits, risky behaviors like smoking and tanning, access to care issues, and then awareness and items that reminded them of their family and friends. So an example of that is that top right corner, you see the bench. That's a memorial of one of our students' grandfather who had passed away. And then if you see the photo of the road, some students took pictures of just the distance and driving to that to Lexington, Kentucky to get good health care, and how difficult that was on their families. So this has been a really powerful project. We've had this displayed in multiple areas in Kentucky. Lexington, we've been in lots of art centers and on UK's campus in the hospital and in our research building. And then statewide, we've tried to go into a lot of Appalachian counties. We've been in Moorhead and Jackson, Berea. We were also in the Kentucky State Capitol for almost a year, and Mount Sterling, Ashland. And then it's also gone national in a few areas for different conferences. It's been in Las Vegas, San Diego, and Chicago. And we'll be going to Denver next April. So lots of opportunities to display these photos and get community members talking about them. So ultimately through the photo voice, but also our writing projects, our Appalachian Kentucky students are learning about cancer in their communities, and they're promoting engagement around cancer risk factors and risk reduction. And ultimately these projects hopefully are reaching people who would not normally pick up a cancer research article. So I'm going to start turning it over to our 3 awesome students that we have with us today. And they're going to tell you a little bit more about their experience with the action program and cancer. So we're going to start with our student, Erica. She's a freshman. And Erica, if you would like to tell everybody who you are, where you're from, and how you got involved in action.
Okay, hi, I'm Erica, and I am a freshman, as Holly said. Currently a biology major on the pre-medicine track. I heard about Action whenever I was a sophomore in high school. Whenever I first heard about it, I was really excited, so excited. I remember going home and telling my dad about it, and I was like, I gotta apply for this. So I applied and got in. My first year with Action was when I was a junior in high school. And recently that ended. So recently my high school time with Action ended because I'm in college now. But I got into the undergraduate Action program as well. And actually, when I was in high school, I began doing research in Dr. Masadi's lab, which focuses on immunology and a lot of the microbiome. And I actually got to stay in that lab for both of my summers, with Action. And I'm actually still in that lab, and it's really cool because I get to see all the progress, and I get to go along with the projects. And we're almost done with one that we started 2 summers ago, which is really incredible. Also, while I was in Action, in the high school Action, I wrote my short story. That was a process. That was such a process. It took all of the 2 years very much, but I think the outcome turned out really good. My story is called Maya's Story, and it's about a girl named Maya. She's in college, and she's planning to be a nurse. So she finds out she has leukemia, and she's devastated and decides to take some time off from college. So she goes back to her little community because she's from Appalachia, and she's from a little rural community. And she goes back to her family, and they're all supportive, and her community is really supportive as well. So I wanted to focus a lot in my story about this because I think it's really important. The small Appalachian communities are just really important, and not everything about cancer has to be negative or negatively seen, because there's also a lot of support from these communities. So I wanted to include that in my story. Um, so also she overcomes cancer. Um, she eventually goes on to finish out college, and she actually becomes an oncologist because her own experience inspired her to help other people who are in similar situations as to what she was in. And so she becomes an oncologist and has her own clinic. And that's pretty much how my story ends. I thought the whole story experience was really nice because I was able to find out a lot about leukemia, and because that's the type of cancer that my story focuses on. And also preventative measures, early action steps, and such things. And it's also really nice because I was able to write in my story about this. And I feel like whenever people read it, they're going to be more informed on such things.
Perfect. Thank you, Erica. Thank you for sharing. All right, I'm going to introduce our next student, which is Kaylee. So Kaylee, same thing. If you will talk about who you are, where you're from, how you got involved in action, and then you're going to talk to us about your photo voice experience.
Thank you, Holly. Hi, my name's Kaylee, and I'm a sophomore at UK this year. My major is agricultural and medical biotechnology, and I have a minor in Appalachian studies, and I'm also on the pre-med track. I'm from Paintsville, Kentucky, and right now I work in a research lab that focuses on planarian worms and stem cells, regeneration, and how all of that affects how planarian worms regrow, and as that relates to cancer. So for those who don't know, Paintsville, Kentucky is far eastern Kentucky, and it's a very rural area that's riddled with cancer, unfortunately, like most rural areas in Kentucky. But so many of my family members have been diagnosed with cancer, but the two that truly hit me the hardest, who I was closest with, were my mama and papa, who both died from lung cancer. In school, I'd never really learned anything about cancer and how that affected people. So obviously when my grandparents died, I was devastated, but I didn't really understand that what had happened wasn't out of the norm, or at least shouldn't have been normal for me, even though it was normal for me, just because so many people died from it. But aside from going to doctor's visits with my mom and papa, I never had any sort of education on cancer. So when I was in high school, one of my teachers introduced the action program to me. I'd already kind of been looking for a way to explore oncology and find out why so many people that I knew had the disease. And I also wanted a chance to kind of branch out and explore new areas of Kentucky. I wanted to be able to educate myself and also educate others about the cancer crisis, and action seemed like the perfect place to do that. I got to learn about all those different kinds of things and also be engaged in research, shadowing, and community engagement. And I got to stay on the University of Kentucky campus, which for me was a big deal because Lexington's like 1,000 times bigger than where I'm from. But it really it gave me a chance to explore, get out there, and it also made me fall in love with the campus. So I got to make many new relationships and friendships, and also learn about oncology, which has steered me now into a future career as an oncologist. But for me, one of my favorite parts of action is community engagement. Anybody who knows me knows that I love to volunteer. I love to talk to people. And I love to engage with my community. So I wanted to take any and every opportunity to get involved and try and spread awareness. So one of the ways, which Holly talked about before, that we managed to stay involved with the community and, start a conversation is the Photo Voice Project. So I think everybody in action has participated in the Photo Voice Project. Like Erica, I was in the high school program and the undergraduate program. So I took the photos for the exhibit when I was in high school. Many of my photos were literal, some were figurative, but a lot of them involved my family members. So one of my photos in particular that was on another slide was of a coal miner's hands, and they were actually my father's hands in the picture. But the photo was staged in order to Represented the history of coal mining and black lung in the region. My father used to work in the coal mines, and so when stating this photo, it allowed me to learn a lot about how his past and coal mines have affected him personally and our family members. So similarly, all of the photos that I took kind of gave me that same opportunity, and the perfect chance to start a conversation about the cancer crisis and ways to prevent it in a more low stakes environment. So I got so many chances to have conversations with family members, community members, friends, and start that conversation, while also learning new things from the people in my community. It was sort of a trade-off in that sense. But by sharing our Photo Boys project across so many communities and the Commonwealth and even the United States, I think we've been able to engage with a lot of different people. And I've had the opportunity to be personally involved with not only my community, but so many other places in presenting. And it's just something that I'm really grateful for, to have get the chance to spread awareness about something that has definitely impacted my life and has impacted so many people in Appalachia.
Thank you, Kaylee. All right, our next student is Kennedy. If I can get it to move, there we go. All right, Kennedy, if you would do the same thing, introduce yourself, where you're from, how you got involved in action, and talk to us about your research.
Hi everyone, I'm Kennedy Lamb. I am majoring in human health sciences at UK. I'm a junior. I also have minors in biology and neuroscience, and I am achieving a certificate in undergraduate research, which is exciting. I'm on the pre-med track. I want to be an OB, so I'm really passionate about like women's healthcare. I'm from Laurel County, Kentucky, which actually isn't too far from Lexington, but the difference between Lexington and London is still like giant. It's definitely a very Appalachian community. So I am actually pretty new to the action program. I didn't hear about it till my sophomore year of college. So I've just joined the cohort 9 undergraduate research action experience, which is fun. But so I heard about action just through like college people that I knew, and I didn't really know that we had something like this that was available to me. So it made me think a lot about like my hometown and the people that I know that have experienced cancer. My aunt had breast cancer, but she's doing great now. They caught it early. And my papa, he worked in the coal industry and he had colon cancer and black lung. So a lot of my first like experience with the healthcare field is actually with him, going to the hospital with him. When I was little, I always wanted to spend the night with him when he was in the hospital, just because I found the healthcare world like exciting. So those two experiences really they primed me for the action program and made me want to get involved, just so I can go back home and like educate my family, who are tobacco users. You know, they do everything the Appalachians do that can promote cancer. So it's important to me to go home and educate my community. But so I just joined the action program, like I said, so I've had the opportunity to be involved in some research and some clinical shadowing. I actually joined a lab before I was aware of the action program, and I was grateful that I was able to stay in that lab. So I'm in Dr. Santolo's lab, and we mostly focus on understanding how like gonadal hormones defend fluid homeostasis, which doesn't sound like it affects cancer that much. But I've been able to steer my research towards cancer. So we mostly focus on estrogen. Like I said, I want to be an OB, so I'm passionate about women's health care, which has to do with like estrogen and estradiol levels. But so me and my PI right now are trying to create and design an experiment that focuses on how obese women, especially postmenopausal women, they are at higher risk for breast cancer. So we're trying to figure out if that's due to like an excess of estrogen or if it's due to something else. So we're in the process of designing an experiment. So that's been fun getting to meet with her. And I'm grateful that Action has provided that opportunity for me. And then Action has also provided like clinical observations. So they sponsored the OLE badge through UK Healthcare, which is like Observe, Learning, and Experiences. I just got the badge this semester, so I've done a little bit of shadowing. I shadowed a pediatric surgeon, which was really fun, definitely out of my comfort zone. So I got to see like some surgeries and go around with him in the OR and do some rounds. I'm hoping in the future to shadow like a gynecologist, oncologist, and some other like cancer specialties. That way it'll open my eyes to some other stuff. But I've been really grateful for the action program, and I'm grateful for the opportunities that it has provided me.
All right. Thank you, Kennedy, and thank you to all three of you. I appreciate you coming on and talking to everybody. All right, so I'm going to turn it back over to Dr. Vanderford. He's going to quickly talk about the cancer education curriculum and kind of our conclusions.
Yeah, so one of the things that we've done over the last couple of years, kind of bridging some gaps between our cancer education activities that we do with students in the program and outreach activities and the need for enhancing students' understanding of cancer. You heard from some of the students that, you know, they'd not really experienced any cancer education activities in school. So there's a need out there for enhancing cancer knowledge in school-age kids. So what we did is we've developed a 3-part cancer education curriculum that covers the very basics of cancer biology, cancer incidence and mortality rates, and we kind of gear that specifically toward Kentucky and the major cancer problem. We cover risk factors, again, highlighting the risk factors that are particularly important in Kentucky. And we have another lesson that focuses on cancer treatments. So the lessons are equipped with PowerPoints and interactive activities. Each of one of them have detailed teacher's guides. We align the material with national academic science standards, but also the Kentucky academic science and health standards. We wanted to make sure that these lessons worked pretty well to do what we wanted them to do before we were ready to distribute them more widely. So we partnered with a couple schools, couple teachers, distributed the material, and we tested them on 223 students. We did pre-test, post-test, so a short pre-test before students interacted with the lessons, and then they interacted with the lessons, and then we did a post-test, which had the same 10 questions that were on the pre-test. This is a very standard pre-post test survey design. And then we plotted the average and median number of correct responses on the pre and the post test. And you can see the panels down below here with lesson 1, 2, and 3. The first portion of these panels are the pre-test data, the upper part, and then the lower part is the post-test data. And the short answer, the short story here is that you can see a shift in the number of correctly answered responses from pre to post, which indicates that students' knowledge in these areas increased significantly from the time, you know, before they interacted with the lesson to after they interacted with the lesson. So we think this is an indicator that the lessons improve cancer knowledge, and it's an opportunity now for us to further distribute this material, get it in the hands of more students and teachers so they can better understand cancer. And ultimately, it's all about hopefully students understanding cancer, cancer risk factors, not participating in some of those risky behaviors like vaping, smoking early on, and having better health behaviors that put them at lower risk for developing cancer long-term. So in conclusion, and then we'll have, I think, plenty of time for some questions and discussion. I hope that you all have a better understanding of Kentucky's cancer problem, ranking first in the nation in cancer incidence rates, second in overall cancer mortality rates. Those rates are highest in Eastern Kentucky. The action program is really here to prepare the next generation of cancer professionals, whether that's researchers, healthcare providers, community engagement professionals, who can help us address the cancer problem in the state, particularly in Eastern Kentucky. And I hope you have a good understanding of our community engagement and outreach activities and how they're really culturally focused and geared toward helping the community better understand the cancer problem and how to lower their risk of getting cancer. So some practical implications of this work. So action can be a model for developing similar programs that could serve areas of similar disparities. So if any of you are in Western Kentucky, for example, I mean, there's a cancer problem everywhere in the state. And this program could serve as a model for developing similar programs. Our approaches to engaging students in the community can be adapted easily to other target audiences. Our program and similar ones have great potential to partner with local and regional cancer prevention and control programs. And such a partnership could really amplify the impact of our program and those local or regional cancer prevention and control programs. And then there's also a lot of opportunity, I think, to leverage these types of programs to inform local, regional, and national policies. There was an announcement at the end of October where we worked with the governor and lieutenant governor in Kentucky to establish October as Cancer Education and Prevention Month. And so through that, we hope that there are more civic organizations that get motivated to help us, disseminate cancer education and prevention material and conduct activities that can help people understand cancer, and again, all geared toward around lowering people's risk for developing cancer.
So then also we wanted to let you all know how you all can get involved. So if you happen to know a student or a group who are from the Appalachian region, please share the Action website and our mission. And the easiest way to do this, if you just go to UK's website and then type in Action in the search bar, you'll find our website. If you want to host our photo exhibit at your school, your library, art community center, or hospital, we are always looking for places to display the art project. So you can reach out to either one of us for more information about that. You can purchase, you can read, you can review and share our published works. You can find them on Amazon, Butler Books, which is our publisher, and then a few local Kentucky bookstores also have our books. You could also request to teach our curriculum to middle or high school students if you are a teacher. And then you can also donate to the Action program, which you can find that button on our website as well. So those are some ways you all can get involved. And then we have our acknowledgements.
Yeah, so before we get into questions, discussion, so without the Action students, this program wouldn't exist. So the students are the rock stars. So you can see some of us at a Kentucky football game a couple years ago now, I think. Holly, who's a program coordinator, makes all the magic happen and works with the students directly. Lauren Hudson Rose and Courtney Martin were two originally undergraduate students who went on to, Lauren went to medical school, and Courtney is finishing up a master's degree and hoping to go to med school soon. But they've worked with me a lot in terms of evaluating different aspects of the Action program. The program's funded by the National Cancer Institute, specifically through a program called the Youth Enjoy Science program. And so we're very thankful for that funding, without which it would be very difficult to run the program. The program is housed in the Markey Cancer Center, and so we are obviously partners with them. Our students in particular, our undergraduates, do a lot of work through the Appalachian Center, and we've also partnered in a number of different ways with the Office of Undergraduate Research. And then not on this slide, we partnered with the UK Healthcare Arts and Healthcare Program, who helped us tremendously getting the in-person exhibits for the Photo Voice Project up and running. So thank them as well. I think we're ready for questions.
We have gotten a few questions. A couple people have asked if we will be able to share these slides. We've been recording the webinar, so I'll definitely be able to share the recording. Holly, do you know if we can share the slides as well?
Yeah, I think that's fine, right?
Okay.
Yeah.
Then yes, we will be able to include the slides in an email I'll send out to all of you after the webinar. This question might have been answered after he asked it, but I just want to go ahead and ask just in case. How can we get our local high school involved? And that is Harlan County High School. You know, you had the get involved slide, but is there anything else you'd like to add?
So we recruit our students every 2 years for the high school program. So right now we are not in a recruiting year. We will be next year at the end of 2025. We would be in a recruiting year. So if you have contacts that you can send me that, science teachers, health teachers, anybody who is a champion for students and wants to share um, academic programs with their students, they don't even have to be a health or science teacher. Um, Getting those names to me is really important so that I can find the right people to contact. And then, you know, participating in the curriculum, the cancer curriculum is another great way to get involved. And then we have not hosted the photo exhibit at a school per se, but if that was something that your school was interested in, maybe we could work with your school library and set it up. And also, have like a book event with the books that we have as well. So there's lots of opportunities to partner with us and get involved.
Yeah, and I'll just add, Holly, you can speak to this more, but we have another program focused for high school students. So even though we recruit every 2 years for the Action High School Student Program, this other program we recruit every year. So Holly, you want to mention that briefly?
Yeah, we have the Summer Health Experience program, or SHE program, which is a 2-week online program for females and underrepresented people in medicine. This is an opportunity for students to participate in a lab experiment completely at home for free. They also get a stipend for participating, and we run that every summer in July. So if you're interested in that, I can send you our flyer and more details about that as well. But same thing with like the action program. If you want to find it, you can go to UK's website and you can type in SHE, like capital letters, or the summer healthcare experience, and you'll find our website for that. And when I share the slides, I'll share both of those websites with you all as well.
And for any of these questions, for anything, you can reach out to either one of us. We're happy to talk more, specifically about your school and your situation or your location and how we can partner.
I can include their emails in the email that I'll send out to everyone because there are several questions about specifically how they can host one of those events. And so maybe that's better to afterwards, just you all connect with them. One person wanted to know, are there any plans to distribute free copies of the materials developed in the Action Art Project, or perhaps some TV spots?
So we do have materials that we distribute at events that we host. So for example, we had the photo exhibit at the Lexington, now I'm drawing a blank, the Arts and Science
Living
Center.
Arts and Science Center.
Thank you. Living Arts and Science Center. And during that, we had the photo exhibit displayed. We have postcards that people can take with them. And then we also had books out on display as well. And we had students there talking about their stories, talking about their photos. So anybody that walked through and wanted a copy did get a copy. So when we have events like that, we do pass out materials that we have.
Yeah, and I mean we've distributed really hundreds of copies of the books for free. And we're happy to, I mean, if somebody wants to partner with us to get them out in their communities or their location, we're happy to have a conversation about that too.
We can also send like 2 or 3 copies to a school library to have on hand in their school libraries, and we've done that with a few schools as well. So if you're interested in that, we can send a few copies.
Awesome. One person wanted to know, does any of the outreach to school administrators include, increasing physical activity and nutrition programs as kind of a prevention method?
So, I mean, we don't get into probably that area that much. I mean, we could, but we haven't. So the lessons are pretty high level. but certainly that is an important aspect, and there are other outreach programs that probably do that kind of activity better than we do.
We often partner with other groups as well, so this isn't a direct answer to that question, but we've partnered with another Kentucky program called #I Can End the Trend. So we'll have our students interact with that program that talks about ending the trend of vaping, and we've had lots of our students participate in that as mentors in that program, and they go out and they um, go to schools as well. So we do try to find partnerships in those fields where we are partnering with a group that's already doing that kind of work.
And then I think this is, well, two more questions. Is there any hope for in the future expanding to Western Kentucky or maybe urban areas of Kentucky that have high cancer rates? Any hope of that?
Yeah, so this program, again, is funded by the National Institutes of Health, and so it's specifically funded to target Eastern Kentucky. This question comes up a lot, so I'm not surprised that it comes up here too. I've had a number of conversations with people that have interest in that, and we'd be happy to help and to partner with people. We didn't get into a lot of the cost of the program, but it's the activities that we do are pretty expensive. I mean, we provide everything for students. For the high school program, they come to campus and stay for 5 weeks, and we pay for housing, we pay for food, we pay for all these things. So it's expensive. So I think to really try to replicate this the way we do it, you need some additional funding to expand to urban areas, Western Kentucky, but it's something that we'd be happy to have conversations with partners.
And right now, our undergrad program focuses only on UK students, but we have talked about expanding that to students in other universities, such as like Morehead State or Pikeville or Berea, and being able to maybe bring on a few undergrads from those areas who are from the Appalachian counties. But that is currently a work in progress. So,
Yeah, we at the end of the day, it's really just me and Holly that are staffing this program, and I have to do a number of other things too. So there's a lot of opportunities and a lot of need, and there's a lot of interest from students and as you all are indicating, from professionals out in Kentucky to expand the program. So ultimately we have interest in doing that. We just need additional help and partnerships to make that happen.
Last question we're going to do here. If I haven't said your question out loud, I've gotten them all written down, and I'll make sure Holly and Dr. Vanderford get those questions. But how many students will you be recruiting in the next cycle?
we recruit 20 students. So it is a pretty highly competitive program because we are recruiting from all 54 counties. So it is pretty intensive. Students write an essay, they need teacher recommendation letters, and they have to understand the dedication that they are putting forward for the program. So it is a 2-year program, which we didn't really get into, and they do have 2 summers, 5-week summer programs that they are completing with us. So sometimes that eliminates a lot of students because they don't want to put that much effort into it, but the ones that do really get an awesome outcome. So it's 20 students, and then same thing with the SHE program. We take on 20 students, and that's from all of Kentucky. So they are competitive programs, but as Dr. Vanford said, we are paying for everything when it comes to these, and in order to give them the best experience, we can only budget for 20.
Okay, well, thank you so much to our wonderful speakers today. It was a great presentation. Thank you for the students for taking your time to come and speak as well. You all did a great job. Like I said, there's going to be a recording of this. I'm putting my email in the chat right now if anyone wants to request a attendance certificate, and just be on the lookout for your inbox for those follow-ups. Everyone have a great rest of the afternoon. Thank you.